we have a community grants program. In 2017, it was about smoking cessation, last year. This year, it's about, physical activity. And one of the things that happens with physical activity, or that we notice, is that more than 50% of the adult population and just 25% of the youth population actually meet the physical activity guidelines, getting enough. And so there's a lot of opportunity there. So we sponsored community grants, and we passed out grants that went from 18,000 to 27,000 to 5 organizations in 2017, just to focus on how do we get more physical activity out there for everyone. Because, United, what we live by is how do we help our members, how do we help people live healthier lives, and how do we make the healthcare system work better for everyone? Absolutely. And physical activity is a big part of that.
I see. A lot of people, because of high detectable or many reasons, they cancel their insurance, and in their mind, they're waiting for probably there is Obamacare, it could change and all that. Let me wait this month, let me wait next month. In the meantime, sometimes, God forbid, something happen and a major bill will come to it. Tell me about that discussion in Washington, and what do you think we're going to end up with?
Well, I think that when I hear of all the discussion in Washington, which is wide-ranging, one of the things that United Healthcare advocates for is that let's get people covered. That's what's important to United Healthcare. The more people that are covered, the better. So we definitely want that. All the different scenarios I hear from Washington talks about pre-existing conditions being part of what's going to be covered.
Yes.
So even whether it's Republican or Democrat, pre-existing conditions sounds like, and Donald Trump, no one is going to mess with covering pre-existing conditions. So I think that is a very important factor, and that's good for folks to know. The only difference with pre-existing conditions is you may need to be continuously insured, which isn't as prevalent now or part of Obamacare now. And I think, so that's an important thing for folks to know when we get there. But right now, pre-existing conditions are covered.
I see. And do you think it's going to be soon? People, when I talk to people, they talk like could be next month. I'm holding to buy insurance and to choose the carrier till next month or so. But that's not going to happen probably till end of next year.
Right. So I think that one of the things, the open enrollment period for the exchanges is shortened this year. So people do have a very definite timeline of when they need to sign up. But I wouldn't recommend that anybody wait to see what the federal government. They've been trying and trying and trying, and it hasn't worked out yet. Right now, they're focused on tax reform, and I think that's going to be a big thing for them to get done by the end of the year. And so it's just, healthcare isn't something to mess with. So I think that if you have an opportunity to be covered, you want to take advantage of that opportunity and not wait and see what's going to happen at some point, maybe in the future.
I see. So if somebody want to switch from any other carrier to your carrier, would he have to wait to be covered, or from the first day that he joined your carrier, it'll continue to cover him?
So Medicaid eligibility for us is determined by the state. So the state tells us, but the way it works is if the person's already in a Medicaid plan, they get once a year, they get the opportunity for open enrollment. There are provisions in there that says if your doctor was in the network and all of a sudden not in, you could, petition the state to get you, out of that plan and pick a plan where your doctors are. United Healthcare, because of where our population is, we're heavily weighted in the Detroit metro area.
Great.
We have a lot of, Arab American doctors that serve our population that we care so much about. And we're always looking at those physicians, making sure we're educating them to make sure they educate our members on the different things.
I see. Although we broadcast nationwide, but our headquarters in Michigan, and in Michigan there is over 500,000 Middle Eastern Arab American community, and I know United Health is very popular with them, and I've noticed myself that.
Right. Yeah. Well, like I said, we really look at disparities, and the last time I was here, we were talking about the hookah epidemic, and we made a lot of progress on that. We talked about women's health issues. We made a lot of progress on that. Today we're talking about diabetes, and we're going to talk about, you know, some of the other, you know, opioids. We want to talk about a little bit too. And you know, some of the things that are out there that we're dealing with, I think, resonate with the population. That they truly see that United Healthcare, you know, cares about the people, cares about them staying healthy, you know, and cares that we're helping them navigate the system. You know, one of the things that we started last year that is not well known out there, it's well known to the people it helped. So, and it hasn't launched nationwide in a significant way. Pieces of it are all across the 26 United Healthcare states for Medicaid. But we call it My Connections here. And what My Connections does is, well, first of all, there's $1 trillion that are spent by government agencies and community agencies on helping, you know, low-income people with essential services and programs. And, you know, the problem with it is there is, you know, different, you know, rules around people being eligible. It gets very complicated because there's a lot of overlap between all these agencies.
Yes.
And what happens is a lot of people fall through the cracks. Well, we started very robustly in Michigan something called My Connections, and that's where United Healthcare people help navigate our members. Some things that we do are member-centric, and some things we do for the community. My Connections is for our members, and what we do is we help them if they have social determinants of health, and that could be, you know, housing issues or homelessness. It could be food insecurities. It could be employment.
And you help those people?
And we help those people. We get them to the right
So you go beyond
agencies.
what you are specialized for as an insurance.
Well, right, exactly. Yes. And the reason we do that is we know all these things, social determinants, affect people's health. Absolutely. And so that's why we started focusing on these social determinants, so we could help people live healthier lives.
Dennis, you mentioned opioid, and honestly, the overdose is getting very scary in the community. We lost a lot of lives in both the Chaldean and the Arab American community, and not just in Michigan but nationwide. We saw this problem. We saw 60 Minutes in Ohio, in the suburbs and all that. Can you please shade what do you do? And I need messages from you, especially to the parents and to the community, how they could watch people who they don't know they have this problem till something happens.
Right. So for opioids, right now, this whole issue, I don't want to say it's a very new issue, but the attention that it's getting now is more recent.
Yes.
And United Healthcare actually has a task force that goes nationwide in dealing with how are we going to identify overuse of opioids. Yes. How are we going to help people who are addicted to them get, you know, off it?
Again,
you know?
taking 10, 15 of them in one time. You know.
Right. So we have these programs are just all being rolled out, you know, in a more robust way. They're always there, but now they're being rolled out. And another big area of attention is physician prescribing patterns and letting physicians know their alternatives and what else could be done to help with this opioid epidemic. But it's a major focus, and it's something that as the next few weeks and months go by, people will feel a little more pressure from companies, United and other companies, healthcare companies, with this focus on it's not, and it's both legal and illicit drugs, because if you cut off one thing, then people go the illegal route and go to heroin, and we don't want that either. So you really got to tackle all ends of this in order to be effective.
Yeah, but again, in the same time, Dennis, when you see a doctor, prescribe 60 or 90 Vicodin, and every month, that means there's something wrong.
Right.
And the insurance should stop that, honestly.
Right.
Yeah.
Right. So, yes, and so our insurance companies are paying a lot more to it, but so is the state. I mean, I just saw a physician today hit my desk that somebody was saying he's indicted. And when because the first thing I want to see, right, they should be. First thing I looked at, is he one of our providers?
Yeah.
And what I found out is the state picked him up and put him on our radar screen for his prescribing patterns, and he was terminated from our network in January of 2017. So by the time this thing went full course all the way out to now, we've been long rid of that particular physician that was prescribing like that. But the focus on those prescribing patterns is going to increase tremendously in the next weeks and months ahead.
I see. Tell me, why should somebody go with the United Health Community Plan, not with other, and what's the difference between you and other, in general, other provider?
Well, I think the best way you could tell it is a story. I recently hired a new chief medical officer at United Healthcare. He started earlier this year. And after 6 months on the job, I said to him, "How's it going? Did you learn anything that you didn't know?" He came from the hospital side. He worked in hospitals. And he used to be the guy that would talk to insurance companies about prior authorizations and that type of thing. And I said, "What was your biggest moment that you just didn't realize how we work internally?" And his answer was, "I never knew you guys cared so much. You truly care about your members." That's the best compliment I think that we can get. And you know what? It's absolutely true. When I talk about not just what we do for our members in routine clinical situations, what we're doing that I described on social determinants of health, in my view, that's more than any of our competitors are doing. And we've placed a lot of homeless people into homes. We helped people find jobs. And a lot of times when this stuff comes up, it's all the time.
Yes.
Food insecurities. As we've gotten more into social determinants, it just surprises me how many people need that type of help, and we do that more robustly than anyone else today.
Yeah, as you see, nationwide, and you are in Michigan, it's multi-part of many ethnic minorities. Do you in your staff or in your organization, you had people that understand the culture, the mentality of those ethnic minorities?
Right.
And we talked today about the Middle Eastern American community. And I know we have Amanda Al-Khatib, and she's doing a great job, and she's in every event.
Right.
Sometimes I tell her, I'm seeing you yesterday, what happened?
Right,
So
right.
tell me more about that educational program that you have with ethnic minority, and especially the Middle Eastern community.
Right. So a couple things on that. So one of the things is I talked about community grants, right?
Yes.
So last year our community grant was on smoking cessation.
Yes.
And some of the grantees work a lot with the Middle Eastern community.
Hookah is very popular.
Right. And that the reason that we didn't want just cigarette smoking,
Yes.
I am careful with my words that it's smoking cessation.
Yes.
Because a lot of the young people in the Middle Eastern community didn't realize the impact that hookah could have on their health. And it's actually worse than what tobacco does.
Absolutely, by far.
Yeah. So, that was last year's. We worked with a couple Middle Eastern, and the results on that, lots of education went out.
Yes.
Lots of good stories came out about that. For example, we did a session in a school with a 9th grade class. And at the end, some of the 9th graders stayed afterwards, and they wanted to know, they told us that, how do we quit without our parents knowing? Because our parents don't know that we smoke.
Yeah.
And there's actually programs. One is called Not on Tobacco, and it's a it's a community-based program. It's age appropriate, and it's not individual. It's a group session, and we referred those kids to that because they were so inspired by that class. And it was a group of kids that stayed late. And the sad thing about that was they just, there's struggles out there, right? And what they said was that, they were just struggling adapting to the new culture, where they came from. It was just hard for them.
Yes.
And so with that, for acceptance, whatever, they started smoking. And so I'm just glad we were able to impact and inspire that group of kids, for example. So that was one thing. This year, we're focused more in our grants program this year. We're focused more on physical activity.
Yes.
And there's some Middle Eastern type community organizations out there that won those grants too. And they're going to be working to promote more physical activity in the communities.
Great. Anything with the refugees, because those are most needed, honestly.
So when I talk about community grants, I talked earlier about some things are reserved for just our members and some things are community events. And so all the grant stuff is community events. It's not member-centric, meaning not just focused on our members. It's focused on everyone in the community.
Great.
So it's hard for me to understand exactly who actually comes to those things, but we rely on the people who win the grants to make sure that they get the message out to the population and bring them in. That's why we do it through community organizations, and we don't do it ourselves, because those people know more about what's out there in the community and can get the right people to get that education.
Well, I think we cover anything. If you have a final word to the community, and if you could, if it's possible, to focus on the overdose and the drugs.
Right.
If you give me 1 minute,
okay,
why they should, especially the parents, pay attention to their kids and see what they're doing, because they don't want to end up with bad news.
Right.
It's too late.
Right. So what I would say on that is United Healthcare Community Plan is committed to our business, and it's committed to our members. Our tagline is, we want to help people live healthier lives, and we want to make the system work better for everyone. And with those two things, it's not just something that we say, it's something that we live and breathe every day. And when I look at, all the things, especially our young people are facing, but older people too, we're trying to cover all the bases, and we're unique that way. The focus I mentioned earlier on what we do with social determinants, what I said our new chief medical officer said when he came, how much we actually really care about our members. I'm not saying everything that we do individually is unique, but I think when you put the whole package together about what we offer, how we're looking for disparities in our membership with the different ethnicities, because not everybody is the same, right?
Absolutely.
And so we're paying close attention, and we get the word out to our partners in the community, and we get the word out to our members on where they need to focus. And I think that the members that are part of United Healthcare Community Plan could easily attest to that. And when I meet them and I see them at different functions that I go to, I feel like there's a lot of appreciation out there for what we do in the community.
Well, Dennis, thank you so much for coming again, and thanks for all the information you gave us.
Thank you.
Thank you so much.
Right. Thanks.
Thank you. Dear viewer, that was my interview with Dennis Morris. He's the CEO of the United Healthcare Community Plan. Honestly, the questions that I asked him, why should I choose United? And it was a great answer from him, because we care about our member and we care about the community. And if you want to switch to any other provider, and this is the time from now to January, think about this, that a provider who care about their member and who care about the community, even if he's not member. And that means so much to the community. Thanks for watching, and good night.